Virtual Wellness Wednesday. I want to thank everyone for taking a moment to join us this evening for our discussion about the state of healthcare and wellness as we navigate the coronavirus pandemic and as we go beyond the pandemic. I'm excited to see the growth of our Go Get Healthy program, and I can't wait to see the impact that this will have on our community. For those of you who may not know, Go Get Healthy is a campaign with the Mayor's Healthy City Initiative. Before the coronavirus pandemic, most of our work focused on food accessibility, things like working to eliminate food deserts, incorporating nutritious foods into gas stations and stores like Dollar General, working with Baton Roots Farm, and distributing nutritious foods throughout our city parish. We've recognized the need for this program to focus on not only food accessibility, but all of the components of physical health that contribute to our health and wellness. Before we begin, I want to take a moment to introduce the members of the Healthy BR and Go Get Healthy team. They make this work possible. Jared Heimowitz is the director of our Healthy City Initiative. Lauren Abear is the program manager for Go Get Healthy. And Kelly Rogers, our grant manager for Go Get Healthy. In addition to our staff, we are welcoming Ellen McKnight, who is joining Healthy BR as a Rebuild Baton Rouge Health Equity Fellow. Our Rebuild Fellowship is a partnership with AmeriCorps. Rebuild Fellows work collaboratively with our office and community partners to address systemic problems like blight, lack of affordable housing, access to health, economic development, food access, and safety, which lead to the continuation of poverty. I want to thank all of you in advance for the effort that you put in to improve the health and wellness of the people of Baton Rouge. Now, I want to turn it over to Ellen, who will start our discussion on underlying and chronic conditions, health and wellness. Ellen?
Thank you so much, Mayor Broome, and good evening, everyone. This is our very first Virtual Wellness Wednesday. So we are excited, and we have a jam-packed 8-week series all lined up for you. We're going to be talking about topics such as underlying conditions today with Dr. Whitfield, but not only that, we've got mental health awareness. We'll also be talking about gardening at home, healthier cooking options with the American Heart Association. We're going to be talking about grocery shopping. We're also going to be talking about prescription adherence. So this is your one-stop shop for all things wellness, right from the comfort of your own living. So thank you so much to Mayor Broome and the Office of Healthy BR for this opportunity to join with you all. And without further ado, we will be locking in with Dr. Rani Whitfield. But before we do that, we want to encourage you to come back to Wellness Wednesday when you get those email shout outs, right? So during this time, we'll be typically talking about our show. This will be our show and tell portion. So the show and tell portion of Wellness Wednesday is going to comprise of you sharing with us your virtual classroom about everything that you learned in the previous session. So for example, today our special guest is Dr. Whitfield, and he'll be talking about underlying conditions. If you have learned something from Dr. Whitfield or from one of our speakers during Virtual Wellness Wednesday, we want you to shoot us an email at healthybr@la.gov. We're going to put that email address in the chat and share what you have incorporated into your life this week as a result of tuning in for Wellness Wednesday. So we're excited about that. Without further ado, we have the world-renowned, ever so awesome, and ever so amazing Dr. Rani Whitfield, okay? Is he here? Is he in the house?
I'm in the building. Can you see me, Ellen?
Can you see him? If you can hear Dr. Whitfield and you can see Dr. Whitfield, go ahead and give us a wave or type in the chat that we can hear you and we can see you. Okay, great. Okay, great. So, Dr. Whitfield.
Yes.
Tell us a little bit about yourself and about your work and how you've evolved in this COVID culture,
Well, firstly, thank you guys for having me. Thank you, Mayor Broome, for all that you've done for our city. I was a part of her health transition team when she was elected, and she's been always focused on health and improvement and betterment of our cities from many aspects. But as a physician, I'm very passionate about health in our community and wellness, and she has been too. So thank you guys for the platform. But about me shortly, I'm a husband, I'm a father, two beautiful kids. I'm known as the hip hop doc because I use music and medicine to educate kids and young people on health issues. And a small of a part of that persona that is become a big part of what I do in the community. And so I've been very blessed to live in this Baton Rouge all my life. I've gone to school here, graduated from the Southern University, who have the greatest marching band in the land, as you all know. And so it's just awesome. I serve on the board of supervisors here at Southern University. I'm on the governor's health equity task force, as well as the governor's council for physical fitness and sports. So as you see, many of the things that I do involve health and wellness and trying to improve our community. So again, thank you for the platform. And that's a little bit about me.
That's awesome, Sauce.
Yeah.
So, as we all know, Mayor Broome was encouraging us to stay safe, healthy, and hopeful at all times here in the city of Baton Rouge.
Yes.
With that, Mayor Broome, what has your office approach been to health equity overall, and has anything changed in this COVID-19 culture?
You said Mayor Broome, what do you mean? You're asking me or Mayor Broome?
Well, so I'm asking Mayor Broome, and then as a result of her response, 9 times out of 10, I just know you're going to jump in with
Okay.
Okay. But Mayor Broome, I understand. Oh, I think you're muted, Mayor Broome.
But I was going to your question, and I know Dr. Whitfield will chime in just to make everybody understand. It's Mayor Broome, not Dr. Broome. So he's the doctor.
I don't know, Mayor. You're pretty good.
Right.
No. I know my lane, and I'll say it.
I do too.
So Ellen, that's a good question about health equity, because when I took office, I recognized that there were some inequities that existed in the healthcare realm in our community. Now, the Mayor's Healthy City Initiative was already in existence, but we tried to take it to another level. For example, when Jared Heimowitz came on board and we had a conversation, we started talking about the social determinants to health. And when Jared started talking about that, I was like, he is in the space and he understands, he's in alignment with my thoughts about health in our community. And so we went on to do a community health needs assessment and joint implementation plan, which was a strategic approach to health in our community at all levels. And so we use this plan to create opportunities for partners to work collaboratively to improve health, prosperity, and equity in low-income and minority communities across East Baton Rouge Parish. And our Mayor's Healthy City Initiative has made it a priority to work with our area healthcare providers and community partners to focus directly on zip codes that we recognize that are the most vulnerable to these inequities.
All right. Dr. Whitfield, I know you were eager to chime on in, so now is the time.
Well, the doctor by proxy, Mayor Broome, said a lot of very good things. But I tell you, Mayor Broome and Ellen, something that I've tussled with, because I've been on the trail to tell folks to wash their hands and social distance. But there's a very thought-provoking quote that a doctor that recently posted and talked about social distancing is a privilege for some people, because some of our blue-collar workers who live in smaller apartment or housing, or some of our homeless folks, they don't have the ability to social distance. Hand washing may be a privilege in some areas in some countries where folks can't wash their hands. So it kind of humbled me a little bit. So when I'm speaking, I'm often thinking about the surroundings and environment that I live in, but not us as a whole, as a total community. And so that's where the mayor's initiatives have become important, because she's looking at not just those that have, but those that don't have. And so health, equal doesn't mean equity. And so in health, we need equity when it comes to access to care. There's many people in our community that are just underinsured, but uninsured. So I know it's a tough challenge for her, but she's done everything that she can to try to to create health equity in our community. And so that's what we should all be about, that everyone should have equal and fair access to treatment. And, this COVID-19 was supposed to be an equal opportunity infected. But we saw that when the numbers came out, 70% of those initially that died from COVID-19 were African Americans. And so there's multiple layers and reasons to why that should be. And there were some folks that were saying that, oh, these are lazy folks or whatever, but that is so untrue. It's dismissive and it's insulting. Many of those that keep the doors open are poor and disenfranchised, the ones that kept the grocery stores open and kept our pharmacies open and provided security for those are living paycheck to paycheck, don't have the ability to work from home or work from the office as I did, and don't have to pay time off. So that's where the mayor and the policy comes into place to try to help those that are disenfranchised or marginalized. And so the best that we can do is all that we can do. But I think providing platforms like this to educate us on how we can stay healthy in a virtual space at home this is free. The mayor's program is free. So individuals that have access can learn about doing things to keep them safe and healthy while they're at home.
I think that's really, really great insight, and particularly from the mayor's office. Yes, like equitable access to healthcare is at the forefront of the programs through Healthy BR, the mayor's office, and then also the partners, so Top Box, Baton Rouge, Baton Rouge, all of those entities and partners are working toward that effort. So I totally and completely agree with you. We talked about 70% of the cases being African American. A lot of the things that we've been hearing trending in the news that's a lot of times due to underlying conditions. Right. And so underlying conditions is, that's the buzzwords, those are the buzz phrases, but exactly what qualifies as an underlying condition? Tell us what it means, in layman's terms, Doc.
So underlying health condition is basically a long-standing medical problem that someone has, like hypertension, obesity, extreme obesity, diabetes, asthma, chronic kidney disease that is either not controlled or not being addressed. And what happens when you have these chronic underlying health conditions, they can suppress the immune system. Our immune system is the fighting system in our body that can fight off bacteria and viruses like the coronavirus. And so we don't even know it, but every day our body is fighting off these parasites, these things that get on us and get in us through our eyes, through our mouth, through our nose. But if you have a very efficient immune system, if you're eating healthy, you're resting, you're not smoking, you're not drinking, or you're drinking minimally, just on special occasions. When the mayor wins and for New Year's, it's the only time you're supposed to drink. So that's twice about every 4 or 5 years. So if you're taking care of yourself, your immune system can usually fight that off. But if you have a chronic underlying condition, a long-standing health condition that suppresses the immune system, it is unable to fight. And so we saw in the initial release of the data that the majority of individuals that died had at least one chronic underlying condition. And hypertension was I think 66% of those individuals had hypertension. And so again, lack of access, lack of resources, maybe not taking medication as prescribed. There are multiple layers as to why people have these poorly managed underlying health conditions. But what's surprising to many people is when I say that I have educated, well-employed people that are financially stable that had COVID-19 with poor side effects or poor results, is because they weren't managing the underlying chronic health conditions that they have. They weren't seeing a doctor on a regular basis. So it's more than just having access and resources, but it's also being responsible for your own health. So there's many layers that we have to address, but in a short definition, that chronic underlying health condition are those things that you've had for long periods of time that either poorly controlled or they've affected the immune system such that you're more susceptible to diseases like coronavirus.
So that's making all the sense in the world to me. So since you said that, that causes me to think about some of the programs that are in place coming from the mayor's office. Mayor Broome, perhaps you can speak to some of the programming that you all have in place for your office in Healthy BR that speak to underlying conditions, prevention, management, and treatment, and so forth.
Well, in our Mayor's Healthy City initiative, we have had partnerships to create experiences to elevate awareness, first of all, around underlying conditions. For example, we have had the Hair and Health, where we train barbers and beauticians to take their clients' blood pressures. And we've done HIV and AIDS work in our community with partners in the community. our partnership with Top Box, which delivers nutritious foods. And of course, one of my favorites, Move with the Mayor.
All
And
right.
that we initiated that where I partner with organizations to promote walking and biking and other. I tell you, I have in the past 2 years, I have rock climbed. I've ridden bike more than I ever had in my entire life. Walked. What else have I? Oh, my most strenuous exercise was going to a fourth grade gym class at West are,
Oh,
are,
boy.
are you in shape as a fourth grader? Oh my God. that was my most strenuous exercise experience. But I say all that to say that what we've been trying to do, and we've been partnering with people who are working in that space. And I've said this even recently, since we have been taking on this COVID-19 crisis. I have seen more collaboration, more communication than I've seen in a long time, focused on navigating through this COVID-19. You know, I've seen people partner. I've seen people work together to come up with solutions. That's what we're doing right now, you know. And so we started this journey with our Mayor's Healthy City initiative. And those are just some of the programs that we put in place to address health needs in Baton Rouge.
And you're absolutely right. Particularly, I enjoy watching the Moves with the Mayor Saturday excursions because you're all over the place, and it's an opportunity for people from all walks of life to come and join you in being physically active, getting out. When outside opens back up, we'll be back with you.
Absolutely, absolutely. Well, Ellen, you know, I have been told that there, and we've got to get the data on this, Dr. Whitfield, somewhere. But
Okay.
if you look around during this COVID-19 stay at home, where people are encouraged to go outside and get fresh air, in my neighborhood personally, I've seen more people riding bikes,
Right.
families. I've seen more people walking. I've seen more people doing running than I've ever seen in my neighborhood before. And, you know, I think that's a good thing. It helps with those underlying conditions. So I'm very grateful to see that taking place.
Mayor, I would add to that, you know, there was a report that came out that said emissions were down. Of course, gas, unfortunately, is cheaper for a reason, but it is helping. And I was walking through the neighborhood with a family and saw a guy in the neighborhood was like, man, I didn't know you lived out here. So, you know, of course, we social distances across the street, but I mean, getting out in the neighborhood, you live in, you know, you're working all day, you come home late at night, you don't get out in the neighborhood, but I've seen more people out and enjoying the beautiful weather that we fortunately have. Is getting a little hot, but you're right. So maybe this will encourage folks, once we can get through this, to get active and remain active.
I definitely think it's going to change the culture around physical activity from, you know, family member to family member, and especially in our neighborhoods. So I think that's one of the positive things that's come out of this COVID-19 space. So you guys have already kind of answered this, but this is a question for Mayor, and then this is a question for Dr. Whitfield. So what practical steps can our friends and our families implement today to help prevent or better manage underlying conditions and chronic disease? So who wants to go first?
Ladies first. I'll let the mayor go first.
Let the mayor go ahead, Mayor.
Well, I think, of course, and Dr. Whitfield mentioned this earlier, we've got to get people connected with primary care physicians or some relationships with doctors. Unfortunately, we have a history of letting the emergency room be our doctor in many cases. And now with the advent of federally qualified health centers, of health centers throughout the community, now with the advent of the Medicaid expansion, we have opportunities to connect people with primary care physicians. So we've got to elevate awareness around that and get people to develop relationships with medical professionals. Secondly, we've got to continue to work on, which is something we're doing in our office, which is access to healthy foods. I got an email from a friend of mine the other day, an attorney, and people who have SNAP benefits should be able to use those dollars for healthy food. They shouldn't be limited in terms of what they can use or where they can use those dollars for healthy foods. And so that's why I love the Top Box concept, where they are going into communities, setting up, whether it's at churches or community centers, to give people access. And that is why we're working tirelessly to get grocery stores that carry healthy foods in communities, in disinvested communities. That's vitally important. And so all of that, in addition to individuals, each one of us taking on the personal responsibility that I want to live a long and healthy life. And Dr. I'm going to toss it to Dr. Whitfield because he can talk on this, and no one will get mad with him if he says that. But we live in the best state in the United States of America, especially yes, when it comes to food. And that's nothing to be ashamed. I mean, we got it. Nobody can imitate and duplicate. We've got it when it comes to good food.
Right.
So much so when I go out of town, nothing compares because my palate has been spoiled here in Louisiana. But the truth is that we also accompany that with high obesity rates here in our state. And so we've got to learn to balance, have that moderation, get that good food, but also balance it with some exercise, or get, one day make sure you're eating healthy and integrating those greens or now the plant-based foods into it. So that's what I would say. And Dr. Whitfield?
I can't say it any better. I think the mayor hit the nail on the head with those recommendations. And that's what I talk to my patients about. It's just about us taking that advice and being serious about it. I will speak specifically to COVID-19 though, because that's, these pandemics, the Katrina catastrophe has a way of exposing the weaknesses in our healthcare system and showing those that are less fortunate how they suffer and struggle through this. And so if you have these underlying health conditions, the first thing you should do is establish relationships or reestablish those relationships with your doctor or doctors. Most people with these chronic underlying health conditions have a primary care doctor, maybe a lung doctor if it's asthma or COPD, a urologist if they have a prostate issue, or infectious disease doctor if it's HIV. So reestablish those relationships. Secondly, we've got to be very vigilant in listening to the recommendations that come from the mayor's office, from the Department of Health, and from the governor. And I'm pretty accurate in this, Mayor, if I'm not correct me, but I think that they are working together. I know we have recommendations that came from the president's office, but it seems like the governors of each state are doing things differently, and they're basing it on the data that's coming from their state. So we have to listen to our mayor, to our governor, and to our Department of Health before we move forward. If you have these chronic underlying health conditions and you contacted your doctor, you're adhering to the rules and regulations, or at least the recommendation, stay at home as much as possible. Plan your trips when you do have to go out and shop. Try to get as much as you can for about a week and a half to 2 weeks. And then, mask up when you're going out. Frequent hand washing, disinfecting your surfaces. These are just behavioral things that we can do. And again, a little bit privileged in saying that because some people don't have access to the funds to buy it. But again, that's where policy in America comes into place. And lastly, for our young people, if you don't have underlying health conditions, you are not immune. You can get infected, but not have symptoms and be carriers. And you can spread that infection to our loved ones or to your loved one. And then they can suffer the poor consequences of this really devastating virus. Mayor, the only thing that I can say, and Ellen, the only thing that I can confidently tell you about coronavirus, COVID-19, SARS-CoV-2, whatever you want to call it, is that it's highly infectious and it's spreading rapidly. It's a new virus that our immune systems have never seen before. And so we don't have the built-in immunity. And I think, Ellen, you're going to talk about mutations. the virus, all viruses mutate as they transfer to person to person. But if the mutations are such that the vaccines or medicines that are designed to treat them, it changes the chemical structure, or it changes the biological structure of that virus, and those medicines and vaccines don't work. So you're constantly trying to stay ahead of the curve. That's why each year there's a new virus, a new influenza virus. But influenza kills about 50 to 60,000 people in a season. This virus has killed over 70,000 people in less than 2 months. So for those who are not taking it seriously, please adhere to what our public officials are telling us, and take this virus seriously.
Ellen, I have a question, if I could interject here.
Uh-oh.
No, I mean, I'm in total agreement. I'm just trying to figure out how do we get people to understand the severity of COVID-19, because we don't want to frighten people. We're not trying to instill fear, but I get a little disheartened when I go into grocery stores and I don't see people with masks on. Yes. And we know that a mask in and of itself does not prevent. Go, Ellen.
She got her mask.
Here's mine. Let me get mine right here for a minute.
That's right.
Here's mine.
Don't make me feel bad. Mine's in my car. I'm at home. I'm safe.
But we are encouraging everyone to mask up, but sometimes I get the impression that people feel like it's business as usual. Yeah. And I don't know what it takes for people to understand the severity. And while a mask may seem simple, it protects you when I wear one, and right. Then you protect me, because that means we're not, that in addition to, just the whole stay at home, the whole crowd issue. That's the other thing, Dr. Whitfield, is that I read a very compelling article in Forbes magazine. Okay. And, even in the business magazine, Ellen, it talks about the fact that when crowds gather, the virus rises. Right. And until we get a vaccine or something, then we have to be guarded. Like I said, I don't want to put people in fear, but we have a new way of living now. And so right. I'm just, Dr. Whitfield, what are your thoughts about that?
I don't have the answer. And I tell you, one thing that has gotten some of my patients' attention is when they lose a family member. And that's not what I want. That's not the way that I want them to get that. So you would hope that they would take heed to the advice of our public health officials and their own physicians. I will tell you that some of the top TV doctors got in trouble for putting misinformation out. And so, maybe we need more representation. So platforms like this is the way. You're going to have some great speakers. I mean, we almost need something like this there every day so that people can get good, constant, healthy, accurate information, and not this misinformation that's been put out in the media. But I don't know what it's going to take. I think there was a quote or tweet that somebody sent me. A guy in California said there's 35 million people in California and only 2,000 died. And I was like, gee, is that your opinions of this? But if that was his family member, I wonder if he would have felt differently. So I don't have the answer. I just know that we're going to continue on the path that we're doing. I think the more information and media that we put out and using at the mayor's office to help us do that, we'll start to reach folks. We'll start to reach them.
I 100% agree. And unfortunately, it's like some of our grandmothers will say, you won't be satisfied until you break your neck, outside riding that bike. And so I think what our public officials and our healthcare providers are trying to encourage us to do is we do not want you to break your neck. We want you to,
we want to prevent.
We want to prevent. Prevention and preparedness. And so that's what we have. That's what we have getting from our healthcare providers and our public officials. And so you spoke to the virus mutating. And so we've been reading those reports. Yep. And so in layman's terms, if the virus were to mutate and get stronger, Dr. Whitfield, what does that mean if the virus mutates and then we meet with flu season? What does that mean?
So mutation basically means that the virus is changing in its structure or its RNA. This is an RNA virus. And I don't want to get too deep in RNA and DNA, but some viruses or bacteria and things are made of DNA, some are made of RNA. So COVID-19, SARS-CoV-2, caused the disease COVID-19 is made up of an RNA virus. And so as it transfers from person to person, there are slight changes in the virus. Usually not enough to cause that much of a problem, but if there's a significant change, and say that there is a vaccine or medication that's used to slow